Hello, welcome. My name is Michael Sandel. Welcome to this university-wide discussion of pandemic ethics. We're going to imagine that we are gathered, all of us, in Sanders Theater, as we might have been on other occasions, to discuss some of the ethical questions raised by the pandemic. Suppose, hypothetically, there were an immunity test for COVID-19 developed. And suppose it were widely available. Suppose everyone could be tested for immunity to COVID-19. How many would be in favor of permitting everyone with immunity to go back to work while everyone else had to continue to isolate to protect the community and themselves? How many are in favor and how many are against the idea of immunity passports in deciding who will be allowed to go back to work? As the votes are tallying, the majority of participants are in favor, but it's a fairly close vote. Right now, about 55 to 45%. So let's begin by those who object. Let's see if there is someone who is against the immunity passport proposal who can articulate his or her objection to begin our discussion. Let's begin with Isabel, a Harvard College student. Isabel, tell us why you object.
Hi, thank you so much for doing this today. I think it's an interesting proposal on the one hand, because of course, we want to pull our country out of economic distress, and getting unemployed people back to work is obviously a priority. But at the same time, I feel like it might create a perverse incentive for people who are not at risk of serious complications to expose themselves to the virus so that they can acquire this passport. And in doing so, they might sort of undermine the efforts to flatten the curve. Also, how is it fair that people who might have been going on spring break in Miami and were ignoring guidelines, like they endangered a lot of other people, but in the course of doing that, gained immunity, and they could go back to work and resume lives as normal. So I think there's an element, like if in theory we could distribute the gains of those who are able to go back to work, that would be an ideal situation, but that seems implausible to me. So
that last point, Isabel, raises an interesting question. You might be more favorably inclined to let those who are immune go back to work if it were on the condition that the income they earned were shared with those who lacked an immunity passport?
I would, but it seems like that it's a complicated proposal. Also, if people think to themselves, well, if I go back to work, the money I make, it's going to be redistributed. So what's the point? I think that could be an issue as well.
All right. So Isabel has given some reasons against the immunity passport idea. Let's see if there are others who also object. Priyanka at the Harvard Business School.
Yes.
Priyanka, what's your objection?
My objection is primarily on privacy grounds. I think even if you are someone who goes to work and you've said like, oh, I don't have the disease, by extension, people would assume that if you're not at work, you do have the disease. And I think that especially when people are going to be doing this at scale, like I don't trust the government to keep tabs on my privacy. And I'm just really skeptical of anything that exposes very personal information like that to my community.
All right, thank you for that. So Priyanka objects on privacy grounds. Isabel objects on grounds that it might create an incentive for people to take risks, maybe dangerous risks, in hopes of acquiring the immunity. Let's hear now from those who support the idea of allowing people to go back to work who do have immunity passports. Let's turn to Jenny Mansbridge, professor in the Kennedy School of Government.
Hi, I can't answer those two very good objections, but I can suggest that perhaps within the group that has immunity passports, those who are in in industries that are particularly suffering should be tried first. Restaurants, other kinds of industries that have been completely destroyed by this, that one would not simply have a 100% immunity passport throughout the land, but try it out first in the most important industries.
So you're in favor, on purely pressing practical grounds, more people back to work.
Yes.
And how do you answer the interesting point that Isabel raised, that if that's the case, why shouldn't the fortunate ones who have immunity be allowed to go back to work, Jenny, only on the condition that they share their earnings with those who can't?
I think that's a very good idea, but I think all of us, whether we're immune or not, who have secure jobs, for example, you and me, we should be sharing our income with those who don't have work. We should have some quite drastic positive taxation at the moment, a one-time tax that would take those of us who are in very secure positions and ask us to give as well.
Thank you for that, Jenny. So we've heard some arguments for and against the idea of an immunity passport as a condition of going back to work. I'd like to put a variation of this idea that was also raised, suggested as a question, in this case by a faculty colleague, about the condition for admitting students back to the campus, back to the Harvard campus. This is not exactly an immunity passport, but it has to do with virus testing. The question supposes, hypothetically, which sadly is not the case yet, that there were a simple and easy and accessible test for the virus, straightforward virus testing. And according to the question proposed by a colleague, why shouldn't we, if we had such a test, say that everybody has to take the test on a daily basis, at least in the immediate future, and those who are virus-free are welcome back on campus, to the dormitories, to the libraries, to the labs, to the classrooms. And those who aren't have to stay away until they pass the virus test. Let's take a vote on this proposal. Readmission to the Harvard campus, but only on the condition of passing a daily virus test. How many would be in favor of that proposal, and how many would be against? This is actually quite a close one, a virtual tie at the moment. Keep voting for another few seconds. Opinion in the group is almost evenly divided on this question. So let's see what people's reasons are and what people's arguments are. More or less evenly divided is this group on the idea of daily virus testing as a condition for returning to the Harvard campus. Who will defend this idea to get our discussion going? Ryan Harrison, I believe you're a student at HBS in the business school, is that right?
That's right.
Okay. All right.
There are lots of preconditions to coming to school. I mean, we have to have a certain number of vaccines and pass other health tests. And so if this is something that really endangers the community by the same logic, if it really would, cause massive harm to lots of people, then there should be no problem in doing this. There's already precedent for it. Daily is a little bit annoying, and if we could get that turnaround to be faster, that would be better, but it's the same principle.
So we require vaccinations, for that matter, to go to the public schools. Why not require, were it available, a quick daily virus test as a condition of returning to the Harvard campus, says Ryan. Let's hear from someone who disagrees. Sharon, in the Graduate School of Design, you're against this idea.
I just feel that with the previous question as well, people with pre-existing health conditions would be more likely to not be immune or not pass the test. So I feel like you're advantaging the people who are already very healthy and strong or younger, most likely, and having those people who are not so healthy with pre-existing conditions will be more likely to suffer in that case.
And so what would you do instead? Would you keep the campus closed for the sake of equity?
I think that unless there's like a solution that would allow people to have resources equally, regardless of your health conditions and age, it would be benefiting people of a certain group over others.
It would be unfair.
It'd be unfair, yeah.
All right, Sharon, stay close by. I want to bring Ryan back in and see. Ryan, what do you say to Sharon?
To the point that it's unfair that some people have pre-existing conditions. Sure, I think that's a fact of life for other vaccines as well, that if you have a certain disease that's highly transmissible, then for the public health safety, I guess you can't be in large groups. And so to the extent that we can know the status of that, or if there's a vaccine, that you should have that before you're allowed to be in a large group. So if we could make accommodations like Zoom classes or recorded classes to accommodate those people, that would be probably a way to get around that, but otherwise, no.
So Ryan, you would imagine that some return to campus, return to the classroom, take classes in person, and those unlucky ones who can't pass the virus test or who lack immunity sit at home and take classes on Zoom as we're doing now.
I think that's a fair way to get around the issue and provides as good of a solution to each party as we can.
Shelby, in the School of Education.
If we're asking people to test themselves every day, I think it's different than asking someone to get a vaccine at this point, because I think we don't know enough about where we're at in terms of how much these things are going to cost. If we're asking somebody to do this every day, I don't think we know what that would be for different people. And I think it could create a barrier for a lot of different people to come to school. And so until I think we could offer a way that we could provide access to all different people in terms of offering different aid to people to pay for those vaccines or to pay for testing, or until we could sort of provide an equitable option for providing a way for them to get that testing, I just don't think that would be the appropriate way to move forward.
Thank you for that. Curtis in FAS.
Hello. So I have a couple of thoughts here. One is we've been talking about these tests as if they are 100% reliable. I think that's doubtful. And if we have a population of several thousand students close together and one person has an invalid certificate of immunity, it's likely that they will precipitate an outbreak within that dense community. Also, what about faculty who are at risk, or other people who are working at the university who are not students, maybe are not being tested on a daily basis, or are contract the virus through this false sense of security? I'm concerned about that. But one of the other things is I'm worried about the idea of equity in the following sense. What if Harvard is one of the few privileged campuses that can reopen its doors because it has a great medical school, it has access to testing, and other schools do not? What kind of society are we living in if we have that kind of inequity?
And if I could just ask you a follow-up.
Yeah.
Curtis, who's a professor in the math department, chairman of the math department. Am I right?
Yes, correct.
Given the inequality that you worry about, that Harvard is privileged, we're imagining that thanks to the Harvard Medical School, we would have access to the test that we're only just imagining. To be sure, there's not the access currently available. But if it were, and if we could do this at Harvard, or other well-off institutions could do this, but many could not, what would you conclude from that? That we should desist from using it?
I think that the benefits of medical advances need to be shared equitably in society, and that the testing prioritization should not be based on small communities like Harvard, but rather on the health status of the individuals that need to be tested.
So you would not use this. You would not like to see Harvard use this, even if we could, as a way of reopening our campus sooner rather than later.
As I said, I think there's several practical issues there, but
Right.
I'm definitely concerned about the privilege issue. I can imagine that we make a moral compromise and do it anyway, but I would be troubled.
So you might do it, but with a heavy heart and maybe a guilty conscience?
Exactly.
Thank you for that. Danielle, a Harvard College student, what do you think?
With regards to the equity problem, I think that there may be a dimension that people have not considered, or maybe have considered, and I haven't seen, they know a solution that I don't. But in the event that we don't open campus because doing so and testing, pursuing that policy wouldn't be an equitable option, that means that outcome-wise, nobody would be getting whatever advantages associated with having campus open. And I do think that having campus open with that policy and having maybe a privileged few get that benefit is superior in outcome, at least, to having nobody get that at all, because we don't think it's equitable and therefore we don't implement it. So in that sense, I do think that even if it only benefits some people, if the alternative is for it to benefit nobody, it's not necessarily better to withhold that just because the distribution is going to be unequal and unfair.
So you would worry about equity, but you would not allow equity concerns to override the desirability of reopening the campus, or I suppose by extension, reopening the economy.
I think that equity concerns are important, but if the alternative is to help nobody, then I do think that helping some people is better than helping none.
All right, well, thank you for that, Danielle. This discussion about equity and about hard choices leads me to another question, a related question that was suggested by one among our participants. And it's a question that suggests an analogy. The analogy is this. It has to do also with life and death. Every year in the United States, quite a large number of people die in auto accidents. On average, it's around 40,000 people a year in the United States die in car crashes. Now, we know that if we lowered the speed limit to 15 or 20 miles an hour, many fewer people would die. But the questioner proposes, we don't do that. We are willing to put up with roughly 40,000 deaths per year for the convenience of having cars and for the convenience and the efficiency of having higher speed limits. Now, that raises the question, should we be willing to pay a similar price in lives in order to reopen large parts of the economy? If we're prepared to do it in the case of auto accidents, why are we not prepared, or should we be prepared to do it in the case of COVID-19? So let's assume hypothetically, here's the question. Let's assume hypothetically that we could reopen large parts of the economy at an annual loss of life to COVID-19 of 40,000 people in the United States. Let's assume we got it down to that. It's likely going to be greater than that this year, alas, but let's assume we could do that. Should we be willing to accept 40,000 deaths annually from COVID in exchange for opening at least large parts of the economy? How many say yes and how many say no? If you say yes, click the yes button. And if you say no, click the no button. It looks like a very slim majority are against this proposal. but it's pretty evenly divided, slight majority against. So let's hear from those who object to the idea and to the analogy with automobile deaths. Who can say, let's clear the raising of hands, and everyone, those of you who object to this policy, if you would now raise your hands, those of you who would like to tell us why. Why do you object? Nadia, a Harvard College student, you're against this proposal. Tell us why.
In comparing, this disease to car accidents, I think there is a level of autonomy in some, not all car accidents are determined by personal choice or by decision, but those say involving distracted driving, those involving, foregoing or ignoring speed limits, those also take into consideration the autonomy of an individual in those, similar to the autonomy one takes up with a vaccine, in getting that vaccine to try to reduce the rate. Now, I know vaccines can only do so much. Folks still get infected, folks still get sick, and folks can still possibly die, but I really wanted to bring up that point within the scenario. So that's kind of why I was against, because since we currently do not have a vaccine, and we don't know like the scope or the extent to what this disease can do and how it can affect the human body, I would be against without that addition.
Okay, thank you for that, Nadia. Let's go to the Harvard Medical School. Lawson, what do you think? You're also against.
I have no easy answer for this. I think as a physician, my placing of the human life as above all sort of overrides other considerations which have become very troubling for me. So for instance, the economic consequences of shutting down society and the quite literally millions of people who are going to be pushed into poverty as a result. And that in itself entails a lot of both economic and health related outcomes which may not be so desirable for society. So I have no easy answer for this, unfortunately.
But you don't like the idea. You voted against.
Yes, I think there are too many unknowns for me. Can we reliably quantify the so-called death toll, and will it be akin to the death toll from automobile accidents? I don't know.
But if it were, what would you think?
I worry about the slippery slope. How many concessions is society willing to take on for the sake of economic progress? I don't know.
Would you reconsider the private automobile, reflecting on the cost in lives?
I would strongly consider alternative measures like slowing down speed limits, perhaps cutting down or implementing measures against drink driving, use of mobile phones while we're in our cars.
Right.
But I'm not sure.
Okay.
I'm not sure ultimately.
Thank you for that, Lawson. Also at the medical school, Sheila, what do you think?
Kind of along similar lines, I guess. As a physician and as a healthcare worker, I think the analogy is a bit different in that I can't catch anybody from anything from anybody in a motor vehicle accident. I can certainly catch a virus from treating somebody with COVID, and thinking about myself, my family, my coworkers, my friends, who are all working in the same healthcare setting. I think it's not comparable. I think the risks to healthcare workers and to society in terms of impact on healthcare workers is different in this case.
All right, so there is an effect on the healthcare providers and others, which is not the case in car accidents, tragic though they are. Let's hear now from someone who disagrees, someone who we've heard a number of people who object to the analogy with car accidents, who think we should not be willing to put up with 40,000 deaths to reopen the economy, but about half, close to half the group voted in favor. So let's now hear from someone who has a reply to these arguments, who thinks that we should be willing to put up with, say, 40,000 deaths in order to get the economy going again. Angela at the Harvard Business School.
Thanks. So I understand the question. I understand Sheila and Lawson's kind of concerns of you don't necessarily know for sure that it's 40,000, but in the hypothetical, we know for sure. I would say, yes, we should reopen. My understanding is that the flu takes somewhere between 30 and 60,000 lives each year, which seems a little bit more comparable than car accidents because it's the same kind of choices that are being made. And then the other thing I would want to think about here is the cost of the shutdown has significant impact on lives as well. So if we are keeping the economy shut down, that's likely somewhere in the 10 to 50,000 life range, probably harder to quantify that. But realistically, not knowing those things and knowing that we do this each year for the flu, it seems like our society has already said this is something we're comfortable with at that death rate. So it seems to make sense.
So Angela makes the case in favor, speaking as a joint HBS Kennedy School student, if I have it right. Let's go back to Lawson at the medical school. You've heard what Angela has said. What's your reply, Lawson?
I'm still troubled by this notion of how many concessions is society willing to make in order for there to be some sort of outcome that outweighs the risks of that initial concession. It's something that is very deeply troubling. I read that some economic modeling which suggests that over 20 million people worldwide additional people worldwide will become, by technical definition, poor as a result of the current pandemic. And so at some point there needs to be a reopening of the economy. I just don't know when that will be or when that should be.
All right. Nadia, did you have a quick reply?
I did. I think I'm going back to the notion, I keep on going back to the notion of autonomy and ability and access to resources to combat this disease. In the flu, comparing it to the flu, that's exactly what I was thinking, in that we've now researched that disease. We now have seen how it affects people, how it affects populations, how it can spread. And yes, while it does change and well, it does like alter each year, and hence why we get our vaccines each year. We have those vaccines available. Meanwhile, we don't for COVID-19 at the moment and currently. So right. I'm more willing to make the concession to the 40,000 deaths. Keeping it in the range of the flu and how many deaths the flu took 34,000 back in the 2019 season. I'd be more willing to concede in that case if we knew that there were measures out to the public that were accessible to folks. But as we don't right now, I think that's what's preventing me from giving into that concession.
Thank you, Nadia, for that. We've been discussing, in a way, cost-benefit analysis, whether numbers of lives, hypothetically, can be compared with other kinds of benefits, including, as Angela points out, the benefits of opening the economy. We've been considering some hypothetical examples. I'd like to now turn to something that is very actual and immediate. Many of us, in order to avoid the risk of going into grocery stores where we may come in contact with people with the virus, where we may find it hard to maintain social distancing, many of us are relying on shoppers and delivery services, which essentially means, if you think about it, I suppose, that we are paying other people to take the risk for us. Now, I'd like to ask what people think about this. Is it ethically objectionable to hire a shopper or someone who works for a gig, someone in the gig economy, to go do our shopping for us, to pay them in effect to take the risk for us. Is that ethically objectionable or not? A lot of us are doing it. How many find it ethically objectionable if you do vote yes? If you don't find it ethically objectionable, vote no. Let's see what people think about what some describe as outsourcing the risk. Fairly evenly divided here. The majority do not find it ethically objectionable, though a substantial portion do find it objectionable. I would say it's roughly 55% object, 45 do not. Let's begin with those who said yes, it is objectionable. What exactly is ethically objectionable about hiring someone who needs the job, who's willing to go into the grocery store with our list and bring the food to our door? Lorenzo in Harvard College, what do you think?
Well, I guess my objection is less on the individual who's doing the hiring and more on the ways society is structured to allow that sort of situation to happen in the first place. I'm just thinking of a hypothetical situation of, say, someone who is, rather, on the lower end of the income spectrum and who really, really needs the money. I don't think that society should be structured in a way such that they would feel as though to feed their children, they would feel the need to go out and essentially be hired to go and take a public health risk for other people.
Right. Given the range of choices different workers face, though, today, and you're pointing to some, what you take to be injustices underlying those different choices that workers have. Given the inequalities that exist today that impel some people to take on jobs that others would not, do you think it's wrong to hire someone who wants that job to go collect groceries and deliver them? Do you think that's wrong?
I would say that I would still think that it might be one ought to go oneself if one can. I think if you can't, I think that's a different story. But if you can, right, even if someone, is willing and able, I don't think putting someone else's life in danger is necessarily morally the right thing to do.
Thank you for that, Lorenzo. Dan, in the Graduate School of Arts and Sciences.
Dan says, I find it objectionable, although we do it. I think I can tolerate it because I imagine the job was already there. And also, I wish I worked in healthcare so I could help more.
Very good. All right. Thank you for that, Dan. Brickty in Harvard College, what do you think?
I think it is unethical. And I understand, as Carolina said, that we already do it, even with like just chemical cleanups, et cetera. But just because we are doing it and that's what our society is and that's how it functions doesn't mean that's the way that it should be. We're basically trading money for our life. And whereas if firefighters or police officers, people who choose to get into that line of work, if the trade, it just doesn't make me, it makes me uncomfortable that we're trading off life for money, especially for the people who can actually go out and buy groceries, but they want that extra safety net. So I know that people are still going to do it. And I guess maybe if I could afford to, I might, but that doesn't mean it's right.
Okay, so Ricky and others are made uneasy, morally uneasy, with paying people to risk their health and their lives. Do I have that right, Brickty? Let's see now who has a reply. Who thinks it's morally acceptable to hire people to go out and undertake risks and do the shopping for the rest of us, and can reply to the arguments that Brickty and others have made. Ilan at Harvard Business School.
I think it is morally acceptable as long as you believe that the person taking that risk is making an informed choice.
An informed choice.
And that, I think, will depend on both the quality of the social safety net and the geography they're operating in, as well as their education. I'd also like to add that we already operate in a system where we pay others to take risks. In the sense we buy insurance. You could also say to some degree it's unethical to buy insurance because we're transferring our risk to somebody else, or even perhaps seeking medical care. When you go seek medical care, you're placing the doctor who's treating you at risk because they might get the virus that you have. And so to some degree, I think you can compare these phenomena.
All right, so let's go back. Let's bring Brick T back in. You've heard what Ilan has said. So long as there is informed consent, and Ilan also added a safety net so that people are not forced into these jobs out of utter desperation. Ilan, do I have that right? Brick T, what do you say to Ilan?
I think in those cases, it would be acceptable, except for the fact that people are not just going out currently in this time when they're being told to stay home just because they want to. Like, they're doing it because that's their way of like survival. And I know we could bring up so many examples of the ways that we already do things like this, but like my point is, just because that's the way we do it doesn't mean it's right. And I understand that it's impossible to be ethically correct in all parts of our life, because then that would just mean we're a perfect society. But still, like this, especially in this time right now, like with COVID-19, this payment when we could go and do it ourselves, because if we're in a hospital, it's not like we can do cure ourselves. But here we can go out and buy groceries ourselves, but instead we're transferring that risk, and that risk is more than just like somebody slipping and falling, etc. This is they could die, their children could die, their other family members could die, and no one's trying to stack up on money, which I'm sure some are. Some people are trying to do this purely for survival.
Ilan, what do you say?
So I think that's right. I guess the assumption I had in my argument was that a sufficient social safety net exists such that people aren't forced into that decision. I think it's also improper to assume that everyone who wants to do it does it because they want to survive. I think some people might have, for example, an ethical imperative in which they want to help others. There are a lot of nonprofit such organizations that go shopping for others. And I'd be curious to hear if you think there's an ethical difference based on the fact whether you're paying someone or not to go buy your groceries.
What about that, Brick T? Someone who does it as a volunteer activity?
Then I think they're choosing that to help others, and I don't think there's an ethical issue. In fact, I think, props to them. I feel like there should be thanks given to them. However, there's a difference between the people that are buying it, and I think someone mentioned this, because they need it and like they're older and they can't go out because they're actually they would get hurt, and then the people that are choosing to because it's just safer and they don't have any issues right now, but they're thinking long term and they can afford to pay others to take that long term risk for them. I think there's an issue there.
Thank you for that. Jonathan, in the Harvard Law School, what do you think?
As long as people are finding some way to compensate one another for the risks that others take as a form of a service, no one's autonomy or even dignity is really being violated. So not only would we be respecting people's sense of individuality, but there's also a powerful consequentialist argument that this benefits everyone because it minimizes the total amount of risk on the collective. Fewer people are going out and shopping for themselves. A smaller number of people are able to take on those risks and reduce the amount of cross-transmission. So this also offers a mechanism to more efficiently allocate risks in a way that not only maintains autonomy, but might even actually strengthen it by making sure that people are being acknowledged for the service that they're willing to perform for other people.
Let me shift to another example that would seem to fit, Jonathan, with your notion of respecting people's autonomy, letting people choose what risk to take, provided they're fully informed. That was one of the requirements Ilan added. The race is on now, of course, to develop a vaccine for COVID-19. And the testing process requires, for promising candidates, to test the vaccine on human subjects. And many testing labs are now recruiting test subjects by paying them, by hiring them, people willing to be tested for a possible vaccine for COVID-19. Healthy people, not people who, this is not a treatment for people who already have the condition. It's paying people to take the test. I want to come back. Jonathan, stand by. I want to come back and get your view on this. But first, let's take a vote on whether people find it morally permissible or morally objectionable to pay test subjects to test the vaccine for COVID-19. If it's morally permissible, vote yes. If you think it's morally objectionable, vote no. We'll see what people think. Well, the votes are coming in, and on this one, by a very substantial margin, more than 3-1, this group thinks it's morally permissible to pay people to test the vaccine. Jonathan, while we still have you, how did you vote?
I voted in favor of paying people to try the vaccine.
And that's consistent with the argument you made in the previous case about respecting the autonomy of people to make these decisions, provided their consent is informed.
That's right. And provided they're, one, taken care of by medical experts to the best of their ability, and two, kept in a controlled environment so they can't impose a burden on other people with their choice.
Okay. Now, I want to hear from someone who thinks it's morally objectionable to pay people to undergo testing, paying people to go out and do your grocery shopping. What about paying people to test the vaccine, Brick T? Did you vote that it was morally permissible to pay people to test vaccines, or morally objectionable?
So I said it was morally permissible because
you did. Okay, so okay.
So because I still don't think it's ethical, but it is practical and therefore should be morally permissible, because otherwise then we would be putting everyone else at risk. And I guess it's also that we're not the ones paying them to to get tested for it. It's a company that's doing that.
Well, wait, Brick
That
T.
transfers
Wait. But suppose you're the head of a company, a testing company or a pharmaceutical company that has what looks like a promising vaccine, and you need to test it, and you need to test it as fast as possible. You might ask for volunteers, but you don't have enough. Would you or would you not pay people to test the vaccine? You're the head of the company now.
Yes. So I would because I think it's different than the grocery shopping, because that I'm only concerned about myself. And you can tell yourself that you're trying to reduce the risk of like the whole society, but really you're just trying to reduce your own risk of and your family's risk of getting the disease. While in this case, you're trying to actually minimize the amount of people who are going to be hurt by
Okay, all right, that's an interesting distinction. Now let's hear from someone who objects in principle to paying people to test the vaccine. Who objects to paying people to test the vaccine? Zamina at the Harvard Medical School.
So my objection is really based off of the previous comments that I've been hearing about this idea of consent and what it really means to consent autonomously. For someone who is paying for the vaccine with a risk benefit that we really don't know at this point, does that consent really go back to what other people mentioned as structural barriers that might require them for them to need that money? And I think that's morally different than something like someone doing a delivery service based off of the risk-benefit profile that people have outlined, but also based off of the structures that we currently have in place to allow people to, again, like choose whether or not they, engage in certain activities. This idea of consent really bugs me and makes this morally objectionable, just because of, who are we really targeting? Like, is this disproportionately affecting people of different races, of different socioeconomic brackets? Who is voluntarily paying to, undergo a vaccine trial? And what does it say about the kind of course, we live in a non-ideal society, but what does it say about where we're going in terms of, either, widening the socioeconomic inequalities that we currently face?
Thank you, Zamina, for that. I would like now to bring in two of our participants who have actually gone through the experience of contracting COVID-19 and thankfully, blessedly, have emerged and made a recovery and are joining us as participants in this discussion tonight. Larry and Adele Backout, can we bring you in? And I wonder if one or both of you would like to give whatever reflections you have on the ethical discussions that the ethical debates and dilemmas that we've been considering this evening.
Well, first of all, Michael, thank you very much for hosting this event. On behalf of all of us who've had a chance to participate and learn from you, it's been an interesting and enlightening conversation. Also like to thank all the students and other members of our community who participated in this conversation. I have a number of thoughts, but I'll try and be brief. We live in an imperfect world. I think we would all acknowledge that. Almost everyone who commented tonight said we would like the world to be better. And I think that is our responsibility collectively to try and make it better. But I'm struck by how all of the choices that we seem to face in dealing with this particular problem are bad choices. None are obvious. None is clearly the right thing to do, but act we must. We don't have the luxury of just saying the problem is too hard, we can't deal with it. So we will deal with it, we'll struggle with it, we'll try and make the best choices that we can. I think all of us would like to live in a world in which we could wave away these difficult decisions. But as this conversation has so clearly helped us all realize, that's not a luxury which any of us enjoy at the moment. You want to?
Yeah, I was particularly struck by the range and diversity of people who cared enough about this topic to participate in your really stimulating conversation tonight. So when I see students and faculty from the business school, from the medical school, from the law school, from the Kennedy School, it just reinforces how important it is to have a multidisciplinary approach to think about ethics, to think about science, to think about policies to help us get through this pandemic. So I encourage all of the students and faculty who are working so hard and thinking so hard about these students to continue your good work, because we need you now more than ever.
Well, thank you. Thanks to you both for joining us for this discussion, and how grateful we are that you are through this experience and back at the helm. Thank you so much, Larry and Adele. And a final word to the group as a whole. I really want to thank all of you for joining us in what is an experiment. In ordinary times, we would have convened a discussion like this in Sanders Theater. We would have been physically present to one another. But it strikes me that the spirit in which all of us, all of you, were listening to one another, responding to one another, even where there were disagreements, offered a model of the kind of reasoned public discourse that we need in our society, certainly at this moment of crisis, but also for a healthy civic life beyond the crisis. Thank you all.